Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, a Wellness Way affiliate in Yorkville, Illinois. Happy Monday, everyone. Happy to see all of you joining us. Thank you so much for joining us. Thank you guys for all your shares. Thank you for your stars as well. I really appreciate that. Someone had said you have to send stars in order for you to respond to me. Guys, the stars and things like that, that's actually done by Facebook. That's actually not done by me. So we always appreciate it when you send some love with stars and things like that. I actually appreciate it even more when you share this information. I always appreciate that. And in fact, I actually just appreciate when you just watch it. So if you are watching me right now, go ahead and say hello. Let me know also where you are watching from. I know that we have people from Arizona right now. Hi, Michelle. It's good to see you. We're going to answer some questions. I know I asked this question, I think on Saturday. We had a lot of different responses, almost 30, and I won't be able to get to all of them, but I'm going to go and try to answer as much as I can in quick fire succession. And hopefully you guys get your question answered. And just remember, it's very hard to answer specific questions, especially if you don't have a lab in front of me. But I'll give you the big idea in regards to some of these questions that you guys had answered. I know that I answer some of them on my Instagram page at Dr. Nathan Thompson directly. And so hopefully you guys got a satisfactory answer. I always do my best, but I only have so much time to be able to answer all those different things. So let's go over some awesome things I'm going to talk about with you. Eye health. I'm going to talk about what else? I know that's in the topic or in the title of this description. But I'm going to talk about a lot of different things, and hopefully you find what I'm going to go over very meaningful and also helps you to get some of those questions answered. All right, guys. I always get people reach out to me all the time, especially people who are new and maybe they haven't seen other videos and things like that, is guys, please make sure that you are working with a Wellness Way doctor. Sometimes people message me for a lot of free advice, and I don't necessarily mind doing that, but a lot of it, guys, in order to answer some of these questions, is that you need to get tested. You need to invest in the testing, and you need to invest in the knowledge and the expertise of a Wellness Way doctor. Wellness Way doctors are second to none as far as understanding the Swiss watch principle, guys. So many times we go and maybe we go to a chiropractor, maybe we go to a functional medicine doctor. Guys, Wellness Way doctors are bridging the gap, obviously, between the two. And there's so many times where I shake my head, I wonder, I'm saying, what on earth, is they trying to do by testing and doing a this for that approach? And so make sure, guys, that you are finding a Wellness Way doctor. Go to thewellnessway.com. Right at the very top, you're going to see Find a Clinic. Type in your zip code, and you'll be able to find a clinic nearest to you. If you can't find one nearest, just make sure that you go to the contact page for the Wellness Way, and they'll see if they can find a Wellness Way doctor who can reach out to you remotely via phone call or via Zoom and be able to work with you remotely. I know that I do work with some people remotely. We're currently filled up, but I know that there's other Wellness Way doctors who can help you and give the same approach as far as the approach that I give as well. Now, on top of that, guys, I know that tomorrow night, thank you for those of you who have registered. We have a full inflammation talk for tomorrow night, Tuesday night at 6:15, but the next one is opened up. That is going to be pinned to the top of the page. I believe the date on that is probably August 23rd, which is going to be a Tuesday, 6:15. So if you are in the Chicagoland area and you want my help in person, please make sure that you are at the inflammation talk. It will help you bridge the gap as far as what our approach is, and it will help make sense of how we look at things differently from a different perspective, guys, because first and foremost, inflammation is the spark that leads to every single degenerative disease out there. Heart disease, cancer, thyroid issues, female hormone issues, male hormone issues. You name it, it is all tied to inflammation first and foremost. So make sure if you are watching this from the Chicagoland area, go to the top of the page and register for our next in-person event at 6:15, August 23rd. Here at this office. We would love to have you there, and we'll also have a special gift for you at the end. Now on Saturday, we have over 23 men in person who are doing our Man Up Challenge. how to increase testosterone with all the gimmicks. And what's really awesome is right now we just started as men a 3-day water-only fast. And we started it last night. So I'm at 24 hours of fasting. And this is actually my 5th week in a row of doing a 3-day water fast, if you can believe that. No, I don't recommend it. No, I'm not telling people to do it. But I just tend to do the very hard things. I like to do hard things. And remember, whenever I ask a person to do something, I will promise you this, I've already done it. And I've already probably gone to a level 10 times higher than what I'm asking you to do it. So this is going to be my 5th 3-day water fast in as many weeks. I am ready to be done with it, to be honest with you. All right. So let's go over a couple of questions. Thank you again for submitting your questions. This one comes from Michelle. Okay. This comes from Michelle. She wants to know about her eye twitching. Seems like when stress levels are high, is it correlated to high cortisol? Okay. Now, guys, I want you to know something, especially the eyelid under or above, and if it tends to twitch. Rather than think about stress, because I like how you're kind of maybe trying to bridge the gap between the two. But guys, anytime you have eye twitching, muscle spasms, muscle twitching, this guys can also include the heart, which is also known as AFib. One of the reasons why, and I would actually, my opinion is the biggest reason why this happens, has to do with being mineral deficient. Okay, if you look at what carries a nerve impulse, it's actually sodium and potassium. Magnesium is involved as well. And guys, I would venture to say that most of you watching are in fact actually mineral deficient. Okay, so I want you to think of how much salt and potassium you need in a day. And it comes out to about 4 to 5 grams of salt and 4 to 5 grams of potassium per day. And you need basically anywhere from a minimum of 800 to 1,000 milligrams of magnesium every single day. And some of that can be largely dependent on whether you are exercising and sweating and things like that, because therefore that will actually go up because you're going to be losing minerals, otherwise known as electrolytes, when you are exercising. So guys, one of the things that I want you to know is why does it happen when you are under like a higher amount of stress? Well, when you are under a higher amount of stress, just think that you are going to be using those minerals at a higher rate when you are under stress. And so it not necessarily the cortisol as much as it's the initial stress response, which is basically adrenaline. Okay, so norepinephrine and epinephrine. This is also why when you have a high amount of stress, this is why you will have problems with cellulite. This is also a reason why your skin will look older, because one of the things that you will get depleted of as well is of B vitamins, and you will also be depleted of vitamin C as well in order to be able to make a stress hormone with norepinephrine and epinephrine. And so you need those things also to be able to make collagen, which means that the quality of your skin, your hair, your nails will go down. So this is why when people are under a high amount of stress, why they will age faster. So when you see that this is actually going on, I would actually look at your intake of potassium, of magnesium, and the amount of either sea salt or pink Himalayan salt that you are consuming. And many times, guys, I will actually tell people, listen, you need to be increasing your consumption of potassium, of magnesium, and of salt, because most people are woefully inadequate with their intake. Now, guys, you can get enough potassium, you can get magnesium from anything that grows from the ground, but when you think about it, most of us aren't getting 8 to 12 servings of veggies every single day. In fact, one of the best sources from food of potassium is actually avocados, not bananas. It's actually avocados, because any kind of food with a sugar attached to potassium, you will not utilize that. In fact, if it's attached to a fat, you'll actually utilize the potassium a whole heck of a lot better. So remember, nerves that run on electrolytes are then go to the muscle. And so if you have muscles twitching, think of the connection of that nerve connection and how that might be inadequate. And this also includes the heart. But thank you for that question. Okay. Arda asked a question about managing type 1 diabetes for youth. Okay. Now, most of the time we are dealing with type 2 diabetes. And one of the biggest reasons for type 2 diabetes, guys, is I will say the big three really has to do with the overconsumption of processed sugar leading to insulin resistance. Number two can also be to a very poor microbiome that's leading to a decrease or an insufficient short-chain fatty acid response that has to do with blood sugar control as well. And then also you have number three is you have a chronic stress response. So high cortisol in a person, and that can be due to a lot of different things. This can be due to chronic smoking, this nicotine use, that can be to mental stress. This can be also due to over-exercise, guys. All of this will lead to poor blood sugar control, but we would call that type 2 diabetes. Now, type 1 diabetes really has to do with either an autoimmune response or many times someone can go from type 2 into type 1 because now they become insulin dependent due to pancreatic fatigue. And this is a long-term response of being a type 2 diabetic because medically they just do nothing in order to get to the cause, and they just keep running that pancreas ragged until finally it gives out, and they know that if you don't, this is what we're going to start off with, and we're going to keep going until finally you're going to need to be on insulin. So type 1 is insulin dependent, type 2 non-insulin dependent, but type 1 many times is an autoimmune reaction, guys. Anytime there's any kind of autoimmune reaction, doesn't matter what it is, because there's 100 different ones, over 100 that they've diagnosed. The first and foremost thing is if you are managing this in youth, the first thing that you have to figure out is what is the trigger, or what is the proverbial sliver that is causing the immune system to consistently respond. Remember, if you put a sliver underneath your skin, that immune system is going to be attacking that sliver. It's going to try to wall it off. It's never going to stop until you remove that sliver. So there are many different mechanisms for autoimmunity, but the idea is the same, is what is the thing that is insulting the immune system that would cause it to actually have to clean out the beta cells of the pancreas. Guys, many times when you're talking about autoimmunity, especially when it comes to type 1, is my opinion is something that a lot of people don't like. And I guess the only thing that I can tell you is I guess it doesn't matter if you like my opinion or not. Because this right here, I would say the number one reason why for type 1 diabetes, and you can actually look this up, because when you see type 1 diabetes exploding over the last 30 years or so, it has to have been something that we have dramatically increased over the last 30 years. And I will tell you, you can go ahead and look up the role of the MMR you-know-what and type 1 diabetes. That is huge. And then number two, I would also say, so stop insulting the immune system by continually bypassing barriers and injecting foreign proteins. And then number two, I would actually get a food allergy test, because casein can really, really trigger an immune response when it comes to type 1 diabetes, and casein is known as the devil in the milk, okay? So this is actually dairy can make it worse. So number one, you have to stop insulting the immune system in order to be able to let that immune response start to calm down. But the other thing is too, is when it comes to type 1 diabetes, a lot of people think, well, I can just eat as much sugar as I want because I have this insulin handy, and I have an automatic insulin responder, and it'll just put in some insulin, and so I can eat whatever I want. No, even type 1 diabetes have to think about type 2 diabetes. So you could be a type 1 diabetic and also become type 2. You can be type 2 and also become type 1. You can actually be both. Now, one of the hardest things when it comes to diabetes, type 1 especially, is actually keeping that blood sugar stable. Because, so number one, you really do still need carbs that are very slowly absorbed, particularly when you are talking about athletic activity, because doing simple carbs is going to cause that blood sugar to spike up quite a bit, and then you're going to have a subsequent lower blood sugars at that point, which is then going to cause a cortisol response. And so you're going to get a spike of cortisol, which is then going to try to mobilize sugars again, from a stored sugar like glycogen, and it's going to spike that way up. That's why it's a lot harder to manage your diabetes, especially when you are exercising, particularly when it comes to type 1. So one of the ways that you can help with it is still eat correctly, all right? And use carbs should be consumed in the form of very slowly absorbed carbohydrates, and not simple carbohydrates, okay? So that's one of the things, but you also have to be able to handle the stress response, and because the stress response will really cause those blood sugars to go out of control. So hopefully that answers your question. I appreciate it, okay? Brenda asked the question. Thank you, Brenda, for asking this question. Help when all my hormones are low or below low on Dutch, okay? So you have the Dutch test, and I think she's also post-menopausal, okay? Now, guys, when you are doing a Dutch test, you are going to have two different levels. You're going to have your levels where you should be at when you are premenopausal or when you are having a 28-day cycle, and then you're also going to have your hormone levels when it comes to after menopause. And so after menopause, those hormones are going to be a lot lower. What's so interesting is that probably a lot of women don't even realize that these hormones, like your estrogens, your progesterone, are in fact supposed to be lower, and most of the production is actually coming from the adrenal glands. I always shake my head when even a functional medicine doctor or maybe a medical doctor that's doing natural medicine, when they just run to give a woman some kind of hormone replacement, whether it's testosterone pellets or whether it's estradiol or estriol, or if they're giving them progesterone or some kind of progesterone cream or some kind of bioidentical. The reason why I say that is because of this. It's because if someone is low in hormones, then there's always a reason why. Because hormones respond to the environment. And hormones make you feel sick, but they're not the reason why you were sick. And to then just go ahead and indiscriminately dump hormone into the system and then say, oh, look, now it's back to normal, what it does is it covers up the reason why you are sick. And we don't ever want to cover up the reason why you're sick. So getting back to, I have low hormone on a Dutch test, well then there's got to be a reason why. And here's probably the reason why. Number one, and I can just go off clinical experience, is that if someone has very low hormone on a Dutch test, postmenopausal, the first thing that I'm thinking about is what is going on with the immune system, okay? The reason why is because if you have a high inflammatory level, you're going to have low cortisol output. It's just how it works. So low adrenal output. So yeah, you're going to have low cortisol output. You're also going to have low hormone output. And it's a response from the adrenal glands in response to inflammation. I'll give you an example. I have never seen great hormones. I have seen actually tanked hormones when they have mold toxicity, okay? And those hormones aren't going to come back until you address the mold toxicity, and then the body will start to pick back up after that. So if you have low hormones on a Dutch test, I would make sure, number one, that test it further in order to see what's happening with an immune response. Something is causing those adrenal glands to downregulate. Number two, can it be an issue with adrenal fatigue? Well, we always want to run to adrenal fatigue, but I would say the first thing is going to involve the immune system, and the second thing would involve the adrenal glands, because yes, in a high amount of a stress response, yes, you will have an increased nutrient need because you might have a higher stress hormone output. So yes, you can be very deficient in certain things that the adrenal gland needs in order to be able to feed it. But when it comes to hormones, especially post-menopause, I would always think an immune and then also related to some kind of mental stressor especially. And then you can get into all the different types of stress responses that are going on. So if you have a high stress response, you have low stomach acid, poor nutrient absorption. It's going to lead to insufficiencies in certain organs. But then not only that, low stomach acid can actually lead to infections in the GI system, which will then cause the adrenal glands to downregulate even more. So you see how complicated it can actually get. But I want you to think immune system, and I want you to think of chronic mental stress especially. Amy has an awesome question about eye health and inflammation, okay? I know that this is kind of a general question, but let's talk a little bit about eye health because clinically I've seen this get so dramatically better in people even when we were not trying to address the eyes, because a lot of times when it comes to eye health, we think that eye health, or our ability to see, our vision, things like that, there's nothing that we can do about it. That is something actually set in stone. Guys, I have seen a person's prescription change overnight. And that was actually after a very powerful upper cervical adjustment on someone up and through here. And literally they had to change their prescription the next day by getting actually better. So neurologically, you have to be very healthy because remember, is that some of these nerves actually control the vascular supply going to the optic nerve. So if you're having like an increased sympathetic response, and it's going to cause the blood vessels to constrict, that's not going to feed the nerve that is feeding your vision, then it can actually start to change that. And so it's just about understanding neurology. But then in addition to that, you have other things going on when it comes to eye health. Are you feeding the eyes? Guys, you know, one of the amazing things I'll ask people is I'll say, hey, how's your night vision? A lot of people are like, not very good. I don't see very well at night. Well, you probably have a pretty bad vitamin A deficiency. Guys, one of the best things that you can do for a vitamin A deficiency is start eating liver, all right? We should be consuming about anywhere from at least 6 to 9 ounces of liver per week. And a lot of times people say, well, I hate liver. I'm like, okay, great. Well, then just take a liver glandular. And so, you know, if you're taking 4 liver glandulars every day, it would come out to about 7 ounces per week. But remember, one of the best sources of vitamin A are going to come from organ meat and also not from synthetic vitamin A. So anything that you are getting from organ meat is going to be unbelievably nutritious for you. So I want you to think of eye health, start thinking about, you know, increasing your sources of organ meat so that you can increase your vitamin A, okay? So you need to feed the eyes. There's other certain nutrients in eggs and things like that that can help to support eye health. But I probably would say one of the number one things that people are suffering from, especially after 60 years of age, is actually having cataracts. What are cataracts? Well, cataracts are known as age's advanced glycation end stages. And basically what this is the breakdown of the actual lens in the eye, and the reason why it breaks down and starts to cloud actually has to do with your blood sugar. So who are getting cataracts? It's the type 2 diabetics. Who are getting joint replacements? The type 2 diabetics. Who has a lot of stiffness? The type 2 diabetics. And the reason why is because the high blood sugar caused the breakdown of the soft tissues, and the lens of your eye is considered a soft tissue. And so this is what just goes beyond me of why when someone goes in for a cataract surgery, why the doctor isn't doing, you know, measuring their blood sugars, isn't measuring their A1C and their insulin levels, and say, hey, you know, I know that it might be a little bit too late to the ball game for handling this, but let's go ahead and correct those cataracts, but let's make sure that they don't come back, and let's get your blood sugar under control, all right? But that never happens because it's just a treatment, and then let them go ahead and get it again, okay? It's called job security. So eye health, I would look at blood sugar, I would look at vitamin A, I would look at things like lutein, and I also, you know, would look at how healthy are you in your upper cervical neck that's controlling a lot of the vascular supply, going to specifically those cranial nerves that are affecting the eyes, okay? All right, thank you again for that question. Apparently this person's name is Antler. Can a 2-week course of prednisone taken post-op cause ongoing joint pain even 18 months later, okay? Now, with prednisone, I don't know why necessarily, because I probably need a little bit more context when it comes to what kind of surgery that you had, but I wouldn't think that 2 weeks of prednisone would cause ongoing joint pain. But what I would think is maybe the reason why you had the surgery could cause joint pain, or that maybe on a course of antibiotics could have caused the joint pain because of what it does to the microbiome and how it influences the GI system, or the fact that maybe you actually were on pain medications that can cause some issues with the GI system as well. But if you're having ongoing joint pain, then especially when it's systemic, then you actually need to look into see what's happening in the GI system especially, and make sure that you're testing it properly to see if you have any autoimmune responses that are going on, because 18 months later means that something is not right and that something is not healing the way that it's supposed to. You know, remember, we're not supposed to be waking up with unbelievable aches and pains in the morning. And if you are getting it in every joint, then you got to think of something systemic is happening. There's some kind of systemic inflammation. See, this is the difference between having maybe something that might be structural, that it's involving just my knee or just one side of my hip. But when you're talking about, man, my hands and my wrists are stiff, both of my hips are stiff, my knees are stiff, my lower back is stiff, my shoulders are stiff, then you got to think about systemic inflammation especially. Thank you so much, Antler, for that question. Rachel asked a question about help with eczema, okay? I actually had someone reach out today to me and said, yeah, I have a lot of problems with eczema. They want to put me on, you know, some kind of biological, knock the immune system response out. What do you think about that? And I said, well, you know, unless you want cancer later on in life and you want to knock out your immune system, I guess that would be the way to go. But guys, still, that's not getting to the reason why. You don't calm down the immune system. You figure out what the trigger is and why the skin is getting so inflamed. So first thing that I would look at as far as help with eczema is make sure that you are looking at a complete history and seeing what could have been one of the triggers for that. Because guys, when the skin gets inflamed, I always want you to think of GI, because those same cells that are sitting around the immune system, sitting around the barrier of the gastrointestinal system, also have the ability to be able to migrate to the surface of the skin and cause the same type of inflammatory reaction. So I would always look at, especially when it comes to eczema, is I would make sure that you are doing a food allergy test, also looking at a stool test and seeing if there's any kind of infection that is going on. And then also, I would also say, because check for any kind of deficiencies, particularly when it comes to vitamin A. My kids, actually my oldest, when he was 3 to 4 months of age, developed some eczema on his shoulder. And this was when I was, you know, my wife and I, we were very young parents, we didn't know a whole lot. And my wife started to give him a rice cereal, and within like 2 days developed eczema, okay? Well, one of the reasons why, and this just goes to show you, is at 3 to 4 months, a baby has a leaky gut. And so you give them a rice protein and it is just going to leak through the intestinal barrier and is going to cause an immune response. So lo and behold, the eczema went away when we removed what was causing that, and what was causing it was the rice cereal. So the reason why so many kids today have eczema is I want you to think of how they are born, many times a C-section, in which they don't receive some of mom's bacteria going through the vaginal canal. They're given tons of antibiotics, which absolutely destroys the microbiome over time. On top of that, they're given multiple things that insult the immune system at 3 months, 6 months, 9 months, 12 months, 2 years. And it's no wonder so many kids have so many problems with eczema. Not only that, but they're told to go on rice cereal at 3 to 4 months. They're then told to eat solid food at 6 months. And guys, I know that, we'll catch a lot of flack for this, but this is just how it's supposed to be, is babies should be exclusively breastfed until about 12 months of age, until that gastrointestinal barrier starts to seal up. It's leaky because it needs to be open to be able to pass on mother's proteins, antibodies, and things like that during the first year of life to provide nutrition and also to protect them as their immune system starts to build. Remember, babies can't even make antibodies on their own until about 3 months. makes you wonder why they're actually giving any vaccines before 3 to 4 months, because they can't even mount an antibody response to it. But I do know the reason why. It's to train you to become compliant at 6 months and at 12 months and at 18 months. So it makes you wonder really what the agenda actually is. Curtis asked about thinning hair. All right. I'm going to guess maybe Curtis is asking for himself from a man's perspective, but a lot of women ask about thinning hair, okay? Now, there's a lot of different reasons why you can have thinning hair. When a woman's hair thins, immediately they want to think about, well, it's my thyroid gland. But I want you to think of how the hair is thinning, okay? Number one, if the hair falls out, I want you to think of something known as shock loss. If the hair falls out, usually what's happening is there's some kind of infection that has gone on. And basically what the body has said is we don't care about your biotin, we don't care about your zinc, we don't care about anything to nourish the hair follicle because we need to divert these nutrients in order to handle an inflammatory response. And so this is why after COVID, after a surgery, after some kind of major stressor, why you can actually have shock loss. And this is basically if you are combing the hair and the hair is actually starting to fall out. Another reason why is if the hair becomes very thin and doesn't grow very fast, then yes, this can be something involving the metabolism. Yes, this can be something that's involving the thyroid gland, because again, thyroid is setting the tone as far as metabolism. If you look at someone with a hyperthyroid condition, you'll see that their skin gets really oily, their hair grows very fast, their whole metabolism, their metabolic output goes, which is why they have a quickly beating heart. But if you look at hypothyroidism, you're going to see very slowly growing hair, dry skin, you're going to see lethargy, low energy, and things like that. And guys, it's not just taking Synthroid that's going to correct all your problems. There's so many things that can go wrong when it comes to your thyroid, which it might be an issue with a nutrient deficiency. It may be a conversion issue. It may be a transport issue when it comes to certain transport proteins that the liver makes. It may actually be due to estrogen dominance, actually. It may be actually due to taking birth control, and it also may be due to an autoimmune response, or it may be an interference issue because of things like chlorine, bromine, or some kind of heavy metal toxicity that's going on. If you are having thinning hair at the scalp, which means it's actually thinning, and this is like, it's not falling out, but you're seeing that literally the hair follicle is slowly disappearing. I would say for a woman and for a man, the culprit is actually going to be DHT, dihydrotestosterone. Now, men, they can literally, bald by the time if they're going to bald genetically, it will start at puberty. Okay. Now, but so sometimes you're just not really going to get it back, but you can actually slow down the progression of it by actually not doing anything to cause the conversion of testosterone into DHT. And I'll say it again, I said it last Saturday, one of the things that will speed up this conversion of testosterone into DHT and will also cause other problems, including swelling of your prostate, but it will kill that DHT, will kill off the hair follicle, is going to be sugar, insulin, and also alcohol. Those are the biggest culprits. So yes, you can actually slow down the balding process by actually not doing things that are taking testosterone to convert it into DHT. Guys, as far as your hair health is concerned, this is an inside-out thing. This isn't throwing more biotin and some miracle type of shampoo. There is millions of dollars that are made off of you buying into the idea that if you somehow put something magical on your hair, you are actually going to cause it to regrow. Now, one of the interesting things, especially men and with balding, is actually that doctors will prescribe DHT blockers. Actually, things like Rogaine is considered a DHT blocker that you put actually on the scalp and it'll block DHT. I would not recommend that. But also taking certain oral medications will block the conversion of testosterone into DHT. But guys, I have seen this happen on a lab, that if you have a poor lifestyle, you are just shunting it from testosterone into DHT into testosterone and estradiol. Then you will actually you might have a good head of hair, but you are going to have man boobs. Sorry, not sorry. And also some other issues as well. So this is why, guys, it really is about, it's an inside-out job and not an outside-in job. A lot of different reasons, especially for hair loss, okay? Things attributed to aging like cataracts and hearing loss or ringing in the ears. This is what Jane submitted this question. Thank you very much, Jane. I would actually argue the premise of this question. And the reason why is they say, well, it's associated with aging. Guys, I hate the idea of aging because it just accepts that there's nothing that you can do. This is why, you have people who can hardly walk at 45, and you have some people, who are able to climb up ropes and do unbelievable things, yet they're still the same age. It's like the whole, going back to the whole car principle. You have a 1965 Mustang in perfect condition, and you have a 1965 Mustang that's rotten in the junkyard. It's all rotted, that's all rusted out. Well, they're both the same age, but what comes down to whether you're driving it or not really depends on the owner, who was taking care of it. And the same thing when you talk about aging, it's who is the owner. You're the owner of your body, and how have you been taking care of it? And a lot of times people they don't want to accept responsibility of saying, oh, well, it's not my fault. Well, guys, I'm going to tell you something. If we are willing to accept 100% responsibility for our health conditions, it is then and only then will we be able to get better. You can blame your mom, you can blame your dad, you can blame that they didn't raise you right or they gave you bad habits. You can blame your doctor. Your doctor led you down a wrong path, a wrong decision. But ultimately what it comes down to is we live in the age of information. There is no shortage of information now, and there's no shortage, of different perspectives in which you could start doing things a little bit different. I always say, even if it's only 10% your fault, taking 100% responsibility will actually help you to get 10% better, which is a whole lot better than being 0% better. But so I always say that it's not age as much as it's oxidative damage over time. It just so happens that if you have a problem and you have a bad lifestyle, that it takes time in order for it to actually show up as some kind of physical symptoms. So going back to cataracts, cataracts is a blood sugar, it is an insulin issue. And so it's, by controlling that there's no reason why you should have any kind of cataracts. Hearing loss, there's a lot of different reasons, why people can have hearing loss or ring in the ears. I can answer this one maybe a little bit better, but ringing in the ears, I would always look and see if there's some kind of B vitamin deficiency or some kind of mineral deficiency that is going on. And guys, going back to that, if you are stressed and have low stomach acid and have a high amount of mental stress, it is very, very tough for you to get adequate amounts of B vitamins and be able to absorb minerals the way that they're supposed to, especially being in a stressed, low stomach acid environment. Okay, so hopefully, guys, we answered a lot of different a lot of questions. Hopefully, you found value with it. If you did, make sure, guys, that you please share this video and share it with other people, and let them know that there's a different perspective and there's hope. There's hope. So many times we think, well, there's just one perspective. It's the medical perspective. But guys, I actually met with 3 people today. This was actually before, adjusting and after adjusting. 3 people. We went over labs, and these 3 people, they were all either diabetic or pre-diabetic. And actually the one diabetic was taking everything medically, and it was only getting worse. And, basically they were just leading him to being a type 2 and then a type 1 diabetic. And if you don't, doing the same thing, guys, over and over and expecting some kind of different result, that is the definition of insanity. If it's not working, then why would you keep going down the same path and somehow expect some kind of different result? I find it amazing that we've been led down such a bad path when it comes to advice from our doctors, yet we continue to go back. And the reason why is because we have so much faith and we have so much trust. And in fact, we actually almost worship the medical profession as if they cannot do any wrong. Guys, if someone doesn't get 100% better after 4 weeks, people are already complaining with me. And but they're quick to give up. And just remember, what would you rather have? Would you rather have more drugs, more surgery, or would you rather have an approach that makes sense, that gets to the cause, and gives you the responsibility to start changing your life? See, the problem is that people want the answer, but they don't want the responsibility of correcting their problem. And there's a big difference between the two. And I always tell people, I said, the good news, it's 100% up to you. The bad news is that it's 100% up to you as well. It just depends on what perspective you want to come from. So guys, again, if you are from the Chicagoland area, please go to the top. And if you haven't been to our inflammation talk, go to the top, in-person event, August 23rd, 6:15 on a Tuesday. Please register for that. Our next one is tomorrow night. Registration is closed for that. So you can catch the new one in about 4 weeks. And guys, make sure you follow this page, follow Dr. Nathan Thompson, because we'll be posting a lot of awesome stuff throughout the 4 weeks with our Man Up Challenge. I have 48 more hours to basically drink water and minerals only and no food. It's the 5th time in the last 5 weeks. And coming up in the next couple of weeks, I'm going to give you a really exciting announcement that is going to blow you out of the water. At least it did for me, right? So guys, I hope you have an awesome night. Have an awesome rest of your week. I'll probably jump on live real quick on Wednesday night with some awesome, more clinical information. I always appreciate when you watch. I always appreciate when you share. I always appreciate engaging with you wonderful, awesome people. So guys, be well, be blessed. I hope you guys have a great night and a great rest of your week.